Good Tuesday evening. Welcome to BCP Live, a presentation of the Bryan County Patriot. I'm Joey McWilliams, and I'm very thankful that you are on with me tonight and watching this broadcast. We're just continuing to chart through these waters together. I know they have been uncharted waters to this point in time, but we're moving on through and we're learning a little bit more about a lot of things as we go. So I am always pleased and privileged to get to have some fantastic guests on with me to get to talk about things that are actually, going on and very important to what's going on, not only individually, I think, for each one of us, but as our town, our county continues to deal with the situation with which we're faced. COVID-19, coronavirus there. I'm going to go ahead and get those words out of the way right now, because if YouTube is going to boot me, well, let's just get it done quickly. But we're on Facebook Live too, so that's all right. We can stick around with that. We have very special guests from My Family Healthcare. We have Jennifer Nelson and Brooke Walters. Thank you so much, ladies, for joining me tonight. I appreciate the time.
We're glad to be here. Thank you.
Well, listen, I have to ask you, I know healthcare is the topic that is really, it's on everyone's mind and conversation. I mean, from talking about it from presidential press conferences, which are every single day, on down through, and you get things talked about on Facebook. I know there is a lot of good information out there, probably some information that may not be as good, but talk about what this situation has meant for you all, specifically with your clinic.
So what we basically had to do is we had to get together when we knew that COVID was coming to the United States. We basically got together and put together a big list of protocol, all of which was based on the CDC recommendations. So we changed a lot of things about our clinic. We shut down the lobby completely so that patients, didn't have to be in close proximity to each other. We protected the staff. We provided masks, all that kind of thing, to protect them from the airborne pathogen from COVID-19. We also have been seeing sick patients, sometimes outside the clinic, sometimes even in their car. You know what I'm saying? Just to prevent, further germs entering the clinic. We also have asked patients not to bring, like if it's a kiddo that we're seeing, we ask that they don't bring more than one parent. That kind of thing, asking that patients come in alone, that kind of thing. So, anything you want to add to that? Several things we've done.
Well, they call to check in, and then we have a nurse call them to let them know their appointment is ready. And like Brooke said, we screen every patient prior to entering the clinic for a fever. If a patient has a fever, then they're asked to go back out to their car, and they will be seen outside. And that includes any swabs that need to be done. They will be done remotely, and we'll just basically do their visit outside for them. And that's to limit exposure to basically our employees.
Right. So, and we've been hearing
keep our employees safe.
Yeah, and we started a lot of, just a lot of increased sanitation measures, like really deeply cleaning the room after each patient leaves. You know what I'm saying? Really doing a thorough cleaning every single time for every patient, just to try to protect that next patient that's going to use that room. So
I would imagine not only the patients, but like you said, your staff, that's been something that's been talked about on the national level as to how important not only the doctors, the nurses, the healthcare folks, how important they are in helping the other people, but they're putting their lives on the line every day. And so I imagine you want to take care of, obviously, of your staff as well.
Oh, absolutely. They were in the forefront of every decision we made because, we've all worked together for several years. We're like one big family up here. So they were number one in our decision making, is to protect them, and then also to protect us, and then protect the next patient we see. And two, obviously, when we protect ourselves, we protect our families. Because I personally have an 11-month-old baby at home.
Right.
I want to do everything I can not to bring anything home to her. You know what I'm saying? So
very much so. I understand. Yeah. 5 children and now 2 grandchildren. And
oh goodness.
So, yeah. It's a big deal. This quarantine stuff is starting to drive me nuts, though, because I'm ready to play with some grandkids. Well, with that in mind, then, and you talk about the fact, by the way, it has all things being equal, and I know very rarely are all things equal, but all things being equal, as you all were talking about going out to take care and visit patients, even in their cars, I can imagine this couldn't have happened at a better time of the year where it's not freezing cold or burning up in this Oklahoma heat to get to do this right now, at least in the spring.
Absolutely.
Well,
it's a good time for it. The weather's been great.
It really has. And I know that's a small thing, but you know, I imagine it could help you all some. You have introduced something else, and I had a chance to visit with Ronnie Walters, with your husband, Brooke, about some of the ways that the medical practice is changing. And one of those in particular, you all are putting into practice there at My Family, and that's the telehealth. Can you talk about that?
We implemented that one day in to starting our COVID precautions. We got that basically implemented within a 24-hour period, and by the end of the day we were both seeing patients via telemed, and that can be done remotely by computer access, by phone access, or by tablet. We do it multiple different venues. Whatever the patient basically can accommodate, we accommodate them and use their access however they can get on to do a telemed visit.
I realize, and I know this is going to date me, but I know there probably aren't any rotary phones left, but there still are, some flip phones and some things along those lines. And there are some landlines within Bryan County as well. Are you able to, are the people able to access this service even with landlines that they don't have the smartphones or things like that?
Yes, it's preferential that we do obviously the video conferencing like you and I are doing, where I can see you, I can hear you. Obviously that's preferential, but we can still do it via telephones. Absolutely.
How would something like that work then? I mean, if you probably can't take my temperature, at least over this video conference right now. How are you able then to make a determination as to what maybe a next step might be?
So a lot of it, for me anyway, is triaging. So basically that my nurse and the front office will triage it. I mean, obviously, if you're running a fever, that's not a telemed visit that I could do. Okay. And so kind of like the kind of visits that we do really depends on the provider. But like I know Jennifer and I, if you're running a fever, you're going to have to come in. I mean, we're going to probably need to do like a flu swab, a strep swab, you know what I'm saying, that kind of thing to work it up. So it's really not for that type of visit necessarily a sick visit, unless it's something simple like I think I may have pink eye, where you can kind of assess that, on a video conference, that kind of thing. So some sick visits can be done, some not. It just depends. But, if I have a patient that, is a diabetic and we need to do her diabetic visit, well, a lot of that can be done. I can glean, what her sugars are running. Is she taking her medicines? What I'm saying, that kind of thing from that visit. And that can be done via video conferencing. And what we've done that's worked really well is we either mail them their lab orders or send them directly to the lab draw center, and the patient can just go there to do their labs that they need, because we're trying to keep as many patients out of the clinic as we can, and really, really minimize exposure and minimize germs, obviously. So.
Well,
you also can do, I'm sorry, I didn't know if I was interrupting you.
No, actually, I was waiting for you, Jennifer. I didn't want to interrupt you. I was going to ask you to talk. Go ahead.
Okay, I said we can also do just our follow-up for depression medications, our face-to-face visits for our home health patient. It's really, really great for our geriatric population, because this way they can stay at home, stay safe, phone in, do this phone call, do a telemed visit, and we can just see how they're doing and start them for their home health. And that way they never leave the comfort of their home.
Yeah.
And with prescriptions now, then let me ask about that, because prescriptions are a big deal. And I realize that's one industry that really hasn't slowed down at all, I would imagine, during this time is the pharmaceutical. Can you take care of them, like you mentioned, you can take care of their prescriptions then through this telemed visit as well? Because if someone has, well, I don't know, controlled substance is the right phrase. It may or may not be, but they've run to the end of their refills. You can take care of those things with the telemed as well, right?
Yes. Mm-hmm. Yeah, it's electronically sent just like an email. So we get in, we click refill, and then it sends just like an email. The pharmacy gets it in just a few seconds. So it's super easy to do that. Yeah.
And the DEA has confirmed at this time, since it's considered an emergency situation, that telemed deems workable for a controlled substance refill.
Okay. Well, and
one thing that I wanted to touch on too is it's really because we live in a very rural area. We're not urban, obviously, and that's great for those patients. You know, I have patients that drive 50 miles one way to see me, so that's been really great too because it saves them gas money, time. It's, you know, just really convenient. Patients are really responding to it well and really liking it, and we love it too because again, we're trying to minimize patients in the clinic as much as we can. So it's been very successful. We are really, really happy about it, and patients have had so many wonderful things to say about it, which has been great to be able to save people time, money, and, you know, the convenience of the thing with everything going on in the world right now.
Okay, Jennifer, I didn't want to interrupt you. I saw you lean
No,
forward.
no, I was thinking, but I wasn't going to say anything yet.
Here on the BCP Live, if you're just tuning in, it's Jennifer Nelson and Brooke Walters from My Family Healthcare. And again, thank you very much for being on. Just a couple more questions then. In light of all that's going on with this COVID situation, and well, I'll just throw this out there. Andrew Cuomo, governor of New York, is on press conference every day. I mean, there are 2 or 3 folks that you can just guarantee seeing their press conference on Facebook or YouTube or whatever it is every day. He spoke about the fact that the change in New York is that they don't need as many normal rooms now. People are trying to set up even more of these COVID rooms because I guess the COVID rooms need to be set up a little bit differently. And my question for you then is that, are we seeing more of that even here in Bryan County, that the numbers of a quote unquote regular visit would go down because people are staying in more right now and they're not having accidents or car wrecks or whatever the case may be?
Well, I believe that's true.
It's 100% true. Our volume is down. You know, I've talked to patients and friends that work in the ERs, in the hospitals in this area. Everybody's volume pretty much across the board is down completely, you know.
For their urgent visits.
Yeah. Brian, one of the other owners, he, you know, moonlights in the ER a lot. And he said that, you know, really the only people coming into the ER right now are ones that really need it, like that are really, really sick. So, I mean, that's obviously been a good thing, you know.
Right.
But
Well, I injured myself. I pulled a muscle, but it was just working around the house. So that was and totally my fault. But we won't go into that right now. That's no. How do people then get in touch with you? Give your contact information, and I've got your website up there, and you might be able to see it right now. So that's how they get to you. Talk about how folks can get to you and receive the care.
The best way would probably be just to call us on the phone. 580-924-5622 is our phone number. We're open 8 to 5, Monday through Friday. Some days we might be closing a little bit early if we don't have many patients. So I would encourage patients to call in the morning, preferably. If you need an appointment or whatever you need, just call us.
And the URL then for the My Family Healthcare? So they can go see it.
Yes, that's it. Yeah.
It's the web address for that right there?
Yes.
Yes, that's it.
That's it right there. Okay. And that web address I'm looking at, myfamilyhealthcarellc.com. Correct?
Yes.
All spelled out so they can get there very, very easily. Well, I really appreciate your time. Is there anything else you'd like to add?
Stay home and wash your hands. Stay home is a big one right now, a very, very big one. You know, we all need to do our part to flatten the curve. So,
and wear your mask out in public. If you don't have a mask, then please wear a bandana or a coverage, because you're not necessarily protecting yourself from other people. You're actually protecting other people from your germs. That's the actual takeaway from wearing a mask or protection out in public.
That is a very good question. May I follow up on that before we let go of that really quickly?
Sure.
That's a very good point to that, because it seems like we learn more about this virus on, news has been 24/7. I mean, everything changes hourly, but we learn more about it all the time, and people are talking about the fact that it does spread and maybe spreads when you speak. So with the washing hands still is priority, right? And keeping the hand sanitizer and all that on there. But the mask,
always and forever, amen on the hand washing.
I learned this when I was a kid. This is nothing new. I'm used to washing my hands and brushing my teeth, things like that. But this is actually, now it's a two-way deterrent. So the washing your hands is helping you. the mask is helping the other person, right?
Mm-hmm.
Yes. And people in health, we just keep saying in healthcare, help us, help you. Like, do what you're supposed to do. You know, if we all do what we're supposed to do, this will be over a lot sooner, because I mean, it's going to last a few more weeks yet. You know, is what the models and the predictions are saying. So help us, help you. Wash your hands and stay home as much as possible.
I feel like we are flattening that curve. I feel like the original projections, we're not going to hit those. And I think that the folks in Bryan County, on the whole, are doing a good job of that.
Absolutely.
All right. Well, Jennifer and Brooke, thank you again for taking time with us on the BCP Live tonight. God bless you all. And I'm praying that you all stay healthy as well with all of your work. You're very much appreciated.
Thank you, Joey. Thanks.
That is Jennifer and Brooke from My Family Healthcare, and I do appreciate them taking the time tonight to stop by BCP Live. Hey, listen, lots of comments tonight. Don, man, do you ever sleep? Don Hyde stopping by and all of his wellness checks at all points in time, doing well right now. I want to say hi to Julie, to Ronnie, Dorothy. Thank you for checking in. They are great healthcare providers. Sarah, thank you for the mention there as well. These two, along with everyone at My Family Healthcare, are doing a great job. We appreciate what they are doing and the help that they are giving to our community. And that was some pretty good instruction tonight. Telehealth, that's easy. I don't have a rotary phone. Okay, I get that. I don't have a rotary phone, but I think there probably maybe one or two still left in Bryan County. I'm just guessing. I would say put a comment. Yeah, comment if you have a rotary phone, but I don't know if you can actually do that or not. So anyway, we'll see. All right, really quickly, just some to wrap up our time tonight. Numbers as of right now, and I don't know that these are necessarily official numbers. I can't say they're official numbers, but the numbers of cases in the United States, 398,000. So just about ready to cross, I'm sure, that 400,000 mark. And nearly 13,000 deaths. Now, I want to just say that tentatively, because are all of the deaths that are reported from a state like a New York always COVID-19 related? And I don't know that that is necessarily the case. So I think we probably could look into that just a little bit more. But anyway, shout out going out to Brent at Gordon Funeral Home tonight. I want to say thanks to all of the advertisers and the sponsors for the Bryan County Patriot, the webpage, continuing to give news and commentary. Now, the commentary is more on our BCP Live. It's generally news when it hits online. Hey, Brian, it's 9 o'clock generally. Just to let you know, it's 9 o'clock. That's the starting time. just so you know. In the future, and we will be on again tomorrow night. Don Hyde, giving a shout out to him. Shout out to Simon and to Daryl and all the guys at Bryan Agra. I appreciate them being a part of what's going on. Rana at Workout Anytime and all of her folks. And we are giving you links to Workout Anytime, to some of the workouts that they are presenting so that you can stay in shape during all of this time. I think I'm going to have to wait till that muscle feels better again. I wasn't kidding about pulling a muscle, actually cleaning things up around the house. That's a true story. And also to Matt and to Darla at Omnicare 365. We're going to visit with them a little bit later on this week, and I am really looking forward to that as well. All right. Well, the Bryan County Patriot reported on Monday that there were 44 people who had stopped by and went through the drive-through testing at the Choctaw parking lot. Sorry, these earphones trying to escape every now and again. The Choctaw parking lot, 35 of them were tested. Now, earlier today, the mayor of Durant posted on Facebook that all 35 tests came back negative. So what do we make of this? And just to think about this quickly as we wrap up tonight, what do we make of this? Well, it's a small sample of a county that has an estimated 48,000 people in it. So 44 people, 35 were tested, all came back negative. The official number right now of those who have tested positive in Bryan County is still 3. That is the official number. So what do we make of this? It's still tough to tell. 48,000 people, give or take, when Southeastern's actually in session. Personally, I'm going to take this as a positive thing. I mean, any time that you can look at a situation like this And every single person that was tested, well, it was just 35. Every single person that was tested negative for this virus. I'm going to go ahead and take it as a positive thing. Now, Mrs. Bryan County Patriot calls me Pollyanna on a regular basis, and that's fine. I'm good with that. You know, Haley Mills, let's go there. She was great. I'm talking about the movie from way back when. But you know, you could look at it a number of other ways. Well, you could also look at it and say, well, they just didn't test the right people. Okay, that's one way to look at it. But if that's going to be the case, and that's the argument, then the right people need to go to get tested. 44 people on Friday. I really thought that with just 100 tests out there, that Bryan County folks going in would shut that place down. There would just be too many people there. I spoke about that last night. I was shocked that only 44 went. So if you're saying that the right people aren't being tested yet, then get the right people there and get them tested. There are curbside appointments right now. Well, not right now. It's 9:20 something, on a Tuesday evening. But during business hours, there are curbside appointments that are available at the Bryan County Health Department. So if you have a fever and if you are symptomatic, get tested. Well, Joey, not everyone that has contracted or carries this virus is symptomatic. You're right. Wow. And some people are just going to get through it and go on. And the more that we stay at home during this month of April, the more that we're going to keep this together. You could say, by the way, also, and there's another way of looking at this. All right, well, it I think it could be done pretty quickly, Brian. I really do. There's another way you could look at it, and I've seen this online too. Well, the worst is yet to come. Okay. And you know what? I'm not going to take away the validity of that statement for one reason in particular. We've seen stuff happen in New York, and depending upon how your internet's set up right now, I'm thinking about this is east, this is west. Just let it go. You've seen it happen in New York. Okay, New York, there are a significant number of people who have contracted this virus. You've seen it happen on the West Coast in Washington and California. There are a significant number of people who have contracted the virus. And granted, generally with fads and with other things, it takes a little while for things from each coast to work their way up or down or over to just little old us right here in Bryan County, right here in flyover country. You could miss us if you didn't look down flying from one coast to the other. So yes, there is a legitimate statement in thinking it could get worse before it gets better. I'll just go ahead and be Pollyanna for a while. I tend to think that that's not going to be the case. But I will say this, it is time for hope. It is time for hope. And if it's not time for hope yet, which I've never lost hope, by the way, and I really believe that many of you all have not lost hope yet either. I haven't lost hope, and I think that the time for hope is always now. It is always a good time to be looking and seeing the positive and seeing how we can get through something. But if it's not, at what point do we get to have hope without folks on social media wanting to, take the air out of your balloon? I've seen people talking about prom on social media and wanting to do something for the seniors, the class of 2020 who did not get a prom, or at least to this point, don't have a prom yet, who won't get to, finish out their senior year in a manner that they're accustomed to finishing out school year. Will they get a chance to walk across the stage? It's possible. I don't know. Don't know how the schools are going to set those things up. But I've watched and I've looked, and I think it's pretty cool that people may be getting together with some kind of prom situation, maybe combining schools. I don't know how it's all going to set up, and I thought that was a great idea, but I looked a little closer because I just had a feeling, and sure enough, as I've watched through this go along, there's always somebody or more than one somebody to say, no, we can't do this. The exact phrase the last time was, what exactly about COVID-19 don't you understand? Well, okay, so we're not doing anything right now. We're under order from the governor, who has a lot of authority right now. And we talked about that with Senator David Bullard last night. We're under that authority to go ahead and to be safer at home is the phrase, safer at home through the first part of May. Okay, that's fine. Can we look ahead to have a prom in late May? At what point do we get to think about prom? What exactly about COVID-19 don't you understand? I'm having a hard time getting that out of my system. Okay, well, I'm sorry. I know I don't understand everything about COVID-19. That's what people who are smarter than me scientifically and medically are trying to figure out so that we can get past it. Do we get to have hope in May? What about late May? Magnolia Fest is still on the calendar for May 28th through the 30th. Do we get to have hope then? If not then, what about June? Do we get to have hope then? At what point do we get to start looking ahead and talking about what we want to do with the next few months without getting thrown down upon or looked down upon for having that hope? I don't want to stay within the four walls of my house through the entirety of the calendar year 2020. And I'll tell you right now, I don't believe the American people will. Won't happen. We may make it through April, possibly into May. Well, but see, this is a virus and it's seasonal. It's going to come back. I think you're going to be hard pressed to get people to go back into their homes. Once we get out, we're going to be like, freedom. That's the way it's very likely going to be. June, July. At what point do we have hope? I'm a sports broadcaster. I'm looking forward to college football, college volleyball, high school football, high school softball. Man, we're ready. Do we get to have hope then? Look ahead. Smile. Get ready. By November, we will be out and about. There will not be a mail-in vote. There will not be a mail-in vote. We want to smile. We want to enjoy it. We want to have some hope. So keep that in mind. I will tell you at what point you should have hope. Have hope right now. Keep that hope ahead. Always think positive. Be wise in what you're doing. Use discretion in your trips out, because we do still have to take trips out and occasionally, not that we're doing everything business as usual, but we still go get food and we socially distance ourselves from people. So be wise, use discretion, but do not walk in fear. I'll tell you at what point to have hope. Have hope right now. Shout out to Brian, to Brent. Hey, listen, always good, man. You're doing a great job. I appreciate you, Brent. Thank you very much. And I think I need to get to call you. Shout out to Josiah. Hey, Josiah, thanks for the text. Appreciate you watching tonight. And to all of the advertisers on the Bryan County Patriot, thank you very much indeed. We have some more guests coming up this week. We're going to talk about some things that I think are of interest to everyone here in Bryan County and how to make a difference in our lives and keep things going. You know, I thought for a while in 2020 I would be talking about hashtag Shop Calera again because of all the construction that would be going on. And I'm looking forward to talking hashtag Shop Calera again. So as we get back out there and the folks are getting back out and doing the construction on the road, and that high rise is being built in the Choctaw Casino area there, and the new hotels coming in. So many good things that we can be talking about. I'm looking forward to that as well. So looking there. I'm not following all of the text there, but hey, listen, we need to go on and do what's needed. Absolutely do what's needed. All right. Well, hey, listen, God bless you all. Susan, if you are watching, I have something for you, so I will get that to you, and just want to give you a heads up on that. Anything else? Anybody else tonight? I missed a couple last night because the comments came in just as I was signing off. So a shout out to Joe Bedwell. Thank you very much for watching. And Paula Sullivan as well. Shout out to you as well. We'll be back on tomorrow night at 9. Thanks again to Jennifer and Brooke for stopping by. My Family Healthcare. Check it out online, myfamilyhealthcarellc.com. In the meantime, wisdom, discretion, but never fear. Let's walk in hope. God bless you. Have a great night.